Hey everyone, my name is Ronco, Advanced City Physio. As promised, the month of February gives us an opportunity to talk about the foot. Today I'm going to be talking about the hind foot, which is kind of the back foot area, and the most common injuries seen and what we can do potentially to prevent them or even treat those injuries. So as you know, this is the foot and this is the ankle joint. So the hind foot is this part right here. The most common injuries that we see in the clinic are ligament sprains. So basically when somebody lands on a funny angle, they either sprain the foot both in or out. The most common injury is spraining the ankle on the outside where the foot goes inwards like this. And that is because the heights of these bones right here called the malleoli, the middle part, the inner part is higher than the lateral or the outer part, so you're more likely, so you have more space to actually move the foot inwards than outwards. So that's why the most times that when we sprain the ankle, it's inside, because there's actually more room in the inner ankle to actually provide that space for the ankle to go in. So 80% of the ankle injuries are on the outside of the foot or sprains, and about 20% are in the inner ankle. So that's, a ligamentous sprain. What we do is we stabilize it, we make sure it's healed properly by using modalities, manual techniques, and basically stabilizing that ankle so that way the ligaments don't get stretched out and sprained more and more again. Okay, so we allow them some time to heal. A very uncommon injury, but not to be missed, is called a high ankle sprain, and that is when the ankle joint or the talocrural joint, like we discussed in our January videos, hyperdorsiflex. So dorsiflexion is basically when the ankle goes all the way up. Okay, so this occurs. Actually, I saw a client who landed. He was bored rock climbing, and he jumped off a boulder and landed in kind of a bit of a hole, and it forced this ankle to go up. And that actually forced a little bit of that high ankle sprain. And the high ankle sprain is basically the separation of the tibia and the fibula. And it's quite painful. So what we do is we actually help stabilize it. Definitely go to the emergency, get it assessed, get it imaged to make sure that it is a high ankle sprain, because it is rare, but it does occur. And in most cases, it requires physical therapy treatment, but best see a doctor about that as well. And then of course we have the sport related injuries where the talus, which is the middle bone, is not moving properly, tracking either forward or backwards properly, and so we develop a little bit of that joint irritation both in the talocrural but also the subtalar joint. What I like to do is basically decompress this ankle joint by giving it a little bit of a traction, mobilization, and then move this talus back using basically a hand placement technique where you just move the talus back as you track the heel. Very effective. A lot of people who have Achilles tendinopathies as well as joint irritation here do have a bit of a stiffer talus, so that really does help that mobility piece where now you can actually dorsiflex or bring your ankle up more, so that allows for that range of motion. That's the most commonly seen injuries in the hind foot that I've seen clinically. Obviously there's a lot more to be discussed here, but we have a limited time. If you would like to know more, or you have an ankle injury that's kind of around the heel that you would like us to look at, please look us up online, advancedcityphysio.com, or you can call or book us in. All our physiotherapists are trained, and we'd be happy to see you. That's all for me for now. I hope you're having a lovely day. Bye bye.